Hello, my name is Brodie and I'm a chief resident at the University of Pittsburgh Department of Plastic Surgery. Thanks for the opportunity to speak. Hand trauma is a common reason for pediatric ER visits and account for about 2.5% of all ER visits for children. 15% of all pediatric fractures are hand fractures. The majority of these are managed non-operatively, but there are a subset of children who require operative treatment. Today, I'd like to share our experience at our pediatric hospital in this population. In particular, I'd like to describe the factors which may predispose to severe injuries requiring operative treatment. This was a retrospective cohort study, which included 850 patients from 2014 to 2019. Patients were divided into two groups, those that required an operation, 126 patients or 15% of the total cohort, and those that were managed non-operatively, 724 patients total. We performed chart abstraction on these patients and then performed a Poisson regression to compute relative risks and 95% confidence intervals. We adjusted for pre-hypothesized confounding variables, including age, gender, and race as appropriate. Here are the baseline characteristics for the entire cohort. The median age was 11 years old, 35% of the cohort was female, and about 29% were minority races. On the right-hand side now, you see the mechanisms of injury going from most common to least common. Sports injuries were the most common, representing 35% of the total cohort. Here are the various injuries of the cohort, with bony injuries being the most common at 74%. Of the bony injuries, phalangeal fractures were the most common, mostly in the ring and the small finger. This forest plot summarizes our comparison of operative injuries to non-operative injuries. On the y-axis are the various risk factors that we assessed, and on the x-axis is a scale of relative risk, going from 0.5 to 9. The blue boxes represent relative risk estimates, and the lines on either side represent 95% confidence intervals. As a reminder, significant findings are those that do not cross 1, which is represented by this vertical line. Breaking apart this graphic, we found that older Caucasian males have a slight, modest but significantly increased risk of operative hand trauma. Compared to all other mechanisms, children using motorized scooters and ATVs were 4 times more likely to require operations compared to other children and other mechanisms. Finally, ring and small finger injuries and metacarpal fractures were more likely to require an operation compared to other areas of the hand. So these are the take-homes. This work highlights risks for complicated injuries which require an operation in pediatric hand trauma. This summarizes one of the largest reported cohorts in this population. How do providers use this information? Well, I think first the study has an important prevention message, which is don't let your kids use a motorized scooter or vehicle because these devices are the ones that lead to operative hand injuries. Second, I think these findings may help ER providers triage certain injuries to earlier referral to hand surgeons. That's all I have. Thank you for your attention, and please feel free to reach out to me with any questions.